Hello and welcome. Welcome to Always Compassionate Home Care. You are joining me for the instructional video of how to do a start of care for a visit. So you will check your name here first to make sure that your designation is that of an RN nurse. Sometimes nurses can have several if they work for both sides of the organization. But we're doing a skilled start of care, so we're starting with RN designation. We will put in our patient's name here. In most cases, this is a test patient, so I do not have the information at present, but you will look into the patient's chart. In the patient profile, you will see the address, phone number. You should be able to see information regarding their insurance company and stuff to that effect. We can go back to home. If you always go back to home, it will bring you to your documents section. The first thing we want to do is look in the patient chart. Under the patient data section, you will find a form that indicates intake. The intake form will have important information on it. The first piece of information that you will be looking for is the patient's diagnosis. That diagnosis code will be the primary diagnosis to be put in to your start of care, which we will review and I will discuss with you. You will also find the patient's doctor and anything important regarding the home visit. Under the physician's orders section, there will be uploaded potentially 2 to 3 documents, some of which are the discharge forms and information from the patient's hospital stay and anything relevant to your home care visit need. We go back to home, where the first thing that we will look at is finding our way around. Your COVID screening tool must be done prior to the entry into the home of the patient you are visiting. So if you have to call the patient from the driveway, you must review the screening tool. We need to make sure that these individuals are free from any symptoms so that you do not become exposed, and potentially vice versa. It could be obviously phone. If you can 6 feet distance from the doorway, that's fine. Obviously, you review the questions, I'm so sorry. Have they been tested? Have they had any symptoms? Obviously, you just follow through with the document. The next thing we're going to do is go into our start of care packet. The first thing we always need to obtain is the home health consent form. Once in the home, we introduce ourselves, we follow our bag technique, we clean our hands, and we get ready to do our assessment. The first part of the home health consent is allowing ourselves and any other individuals from Always Compassionate to provide treatment and care to this patient. The second part of our consent is reviewing the release from responsibility elements that are a requirement by the DOH and standards. We will review the patient bill of rights and responsibilities. We will review the patient privacy rights and practices. These are all within the start of care packets that you can pick up from the offices. You can also ask the office to mail out, but it is recommended that you get a handful of them prior to any visits so that you have them ready to go if you get called for potential start of care. We review or explain the emergency preparedness information, basic home safety, which is important, home care bill of rights, This is our first opportunity to review the advanced directives. It is important and essential that we cover this with the patient, especially those who may not be well versed or educated. We review complaints. The review should encompass their understanding that, of course, they can relay any information or negativity or problems that they may have had to yourself, about you, about any other individual that they have encountered. These calls, of course, should come to the office. The patient can, of course, call the office. They can try to deal with the supervisor regarding any potential issues. And of last resort, should they not be satisfied with any of those outcomes, they can call the Department of Health. We do not fill out the OASIS section. HIPAA, we talk about their privacy rights and assure them that everything's kept safe. We fill out a consent for photography, in case there are present wounds that we can forward to the doctor for his immediate purview and advisement of any further needs for care of the patient, and B, should anything new develop, we can forward it along to the patient's doctor. Permission to release information. This third section is also vital, as the patient needs to understand that at any point in time, any insurance payer is asking us for information for reimbursement purposes. This section is also vital and important to the patient to make them understand that they can allow us to release any records or information to the following persons, there be it their father, their mother, their brother, their son, their daughter, their loved ones, their aunt in Maine, whomever they feel that they want information released to, can be entered into this section. The assignment of insurance benefits. We never do Medicare, so these should never be filled in. Medicaid can be filled in 100%. A commercial insurance can be filled in. Or if it's private pay, you would get the monies and then bring them to the office. Or it could be a combination of both sometimes. In this particular situation, your intake form would have provided you with further information, such as skilled nursing services to this patient, potential PT services, and occupational therapy services, and potentially even a social worker if needed. There may be financial responsibility information on there. If there is not, you can call the office afterwards and complete this section of the document and advise the patient that we will inform them. The last part of this consent is also very important. We want to let them know that this section is giving them permission to allow the Department of Health and any accrediting organization that may come out on visits with us to come to the home or not come to the home. It is important to explain to them the need for this, as we of course don't want multiple patients refusing this. It is something that is beneficial to them, where the department will have another set of eyes to review the care of this patient. Some patients don't want it, and that is fine. Of course, we can put, I do not consent to these visits. Your name will automatically auto-populate the more times you do this. We put the date in, have the patient sign, and of course we accept the signature. If you're satisfied with all fields being complete, we can send to office. If you still know that you need to review the financials or anything else, we can just hit save, and it will be in our pending section on our main form, on our main page, which we will review when we are done. So we finished our home health consent. We're going to start our assessment. The first essential component is your time slip. Your event code will either populate or you will be informed what your event code is. The event code assimilates to your service, in this case skilled nursing. These two codes must be entered properly for it to be able to go to billing for your services to be rendered, as well as insurance purposes. We put in the time of our visit. The signature of the patient is captured at the end of the visit. We again review our patient to make sure it's the correct one. We go into the patient's history. We ask them about their immunizations. These days, of course, other could be COVID-19 vaccine. Have they had a flu vaccine this season? These gray boxes are very important. These gray boxes auto-populate information for your plan of care, which is your doctor's order or a 485. This plan of care or doctor's order is important to have, as it is what is allowing us to do the visits within the home to take care of the patient. Our prognosis. We always hit insert from template. This patient's prognosis is good. They're 52. They had a right knee. It was blown out from all their years of gym days. Advanced directives. Do they have any? This is our second opportunity now to review advanced directives. We discuss it with them. They needed some education. They'll think about it and maybe get back to us. So in this situation, we can write this option. Not available, but family educated and informed of the need for same. We hit insert to form and it fills into our gray box. We need to confirm the physician's doctor with the patient. When was the last time they saw the doctor? When was the last time they had contact with the doctor? Maybe they saw the doctor on Friday before they were discharged for home. It is extremely important that we fill in every bubble. Every radio button is accounted for. For the sake of test, I will just review some of them now and show you why it is important that every field is entered. We have to do a complete safety check of the home, especially with an orthopedic return home, to make sure that there are no reasons that they would obviously have risk for injury. Safety measures. We review our insert from template. We want to make sure that they have clear pathways so that they do not re-injure that knee. They are diabetic, type 1, so diabetic precautions we want to review with them and make them understand that their healing process is extremely important and they want to be diligent on checking their blood sugars. We want to talk to them about fall precautions and using that cane to their benefit, that PT at the facility informed them of. And always standard precautions. Discuss the use of the need of the cane. And to talk to their doctor and therapist, of course, when they think they may feel ready to be done with the device. We hit insert to form. And again, all of our information has populated onto our upcoming order. This section, really important, prior hospitalizations. This would be yes, because they actually did have a hospitalization with the surgery stay. Could they maybe have had 2 others prior? Of course it's possible. Maybe they had 3 ER visits over their lifespan at this moment in time. And a lot of times ER visits are unplanned, but you can continue with that. We hit save, which can bring us to the next page. We did indicate that our primary diagnosis will be provided to us on intake. You most likely will have an ICD-10 code, which can be inputted into this section here. Or if it was just written out,